Good morning, everyone. Thank you for joining us. We'll begin in just a few moments. Good morning, everyone. Thank you for joining us. We'll begin in just a few moments. Good morning, everyone. Thank you for joining us. We're going to begin in just a few moments. All right, thank you everyone for joining us. We're going to go ahead and get started. My name is Susan Melnick, and I'm the Communications Specialist here with ASAP. And we're really excited today to bring you a wonderful webinar about the new PEPFAR Human Resources for Health Reporting Requirement. And we have a great team here from USAID who's going to present today. So I just wanted to go over a couple of things with you. If you've been to our webinars in the past, I wanted to thank you and welcome you back. If you're new here, this will be just a quick overview of how our webinars run. So thank you again all for attending. We use the Q&A box at the bottom of the screen. It's separate from your chat, so feel free to use the chat box to communicate with one another and with us. But for your questions specifically, please try and use the Q&A box. It'll allow us to go through the questions more easily. We have one poll that we'll be running today. It'll pop up at the end of the webinar, about 20 minutes before the end. And it's just going to ask you some questions about how you enjoyed this webinar and any future webinar topics that you'd like to include. We always record these webinars. This webinar is being recorded, and we're going to put it on the ASAP website so that you can watch it again. It'll also have the presentation slides available there. And the USAID team is going to put together a Q&A document for any of the questions that we missed today, as well as the ones that were asked and answered. And so that'll be available as well. The recording and the slides will be available tomorrow. And I'll put the link in the chat in just a few moments, and you'll also receive an email with the information. So far to date, ASAP has conducted 52 webinars with USAID support, and that's more than 10,000 attendees. So we wanted to thank you all so much. We put these on for you, and we're really, really happy to be able to provide them for you each week. This webinar actually will be held on October 6th in French and on, I believe, October 13th in Portuguese. So stay tuned. We're just getting those registration links sent up, and we'll send out an email quite soon with that information. Our webinars are available in 3 languages, so English, French, and Portuguese. And on the ASAP website, you can go and actually filter through the languages there and find one that works for you. And we'll also include a PDF of the presentation on the website as well. And just quickly, our best webinar ideas come from you, our community, our local partners, and we would really love to hear any ideas you have for future webinars. We do webinars in financial management, business development, communications, a huge variety of topics, but the best ideas come from you. So in the chat, feel free right now and throughout the webinar to provide some more ideas if you have future ideas for webinars. And now I'd like to go ahead and introduce today's presenters. We have a great team here from the Health Workforce Branch in USAID's Office of HIV/AIDS. First up is Sarah Ackerman. She's a Science and Technology Policy Fellow with the American Association for the Advancement of Science. We have Jason Rothenbender, who's a social scientist, and also Geraldine Hoover, who's a health science specialist. So I'm going to stop sharing my screen right now and give all control over to Sarah.
Good morning, good afternoon, good evening, everyone. Let me just share my screen. Okay, please let me know if for any reason you cannot see that. So thank you very much, Susan. So my name is Sarah Ackerman, and we're going to start here talking about the new Hrh reporting requirement. So first up, we have our agenda today. So first we'll review an introduction, then we'll take a look at some key data elements in the new inventory. Then we'll look at some specific examples. Then we'll do an overview of the data reporting and how to obtain a datum account for that reporting. And then finally, next steps. And importantly, there will be Q&A opportunities throughout. And colleagues of mine are checking the Q&A box. So please keep putting your questions in there as we go, and then we'll stop and address them as we go. Okay, so to start off for our introduction, human resources for health staffing is a significant investment for PEPFAR. PEPFAR supported over 210,000 healthcare workers in FY20. During the COVID-19 pandemic, PEPFAR supported staff have enabled rapid adaptation to continue the provision of HIV services, and staff have also been leveraged to support the COVID-19 response. And so in this map here, you can see the density of staff, so the darker the blue, more staff, and you can see just how many staff PEPFAR has supported. So the new Hrh reporting requirement aims to better capture staffing and related expenditure. So looking forward, Hrh is critical to further advancement and sustaining HIV gains. The existing data we have does not provide enough insight, and therefore this new data stream will provide more robust data, enabling further optimization and increased accountability. So what we currently know about Hrh. So these two on the left and right here show what is currently known about Hrh data. On the left, we have the MR data. So for Hrh, there's Hrh Cur, Hrh StaffNat, and Hrh Pre. And on the right is ER, which is Expenditure Reporting. And ER, we can take a look at the expenditure or cost of staff that have salaries. You can see their personnel salaries on healthcare workers. That's what HCW stands for. Clinical, ancillary, and other staff. You can see costs on fringe benefits, and you can see costs for contracted workers, again, clinical, ancillary, or other staff. So where does the new Hrh inventory come into play? It comes here. So the new Hrh inventory will replace Hrh Cur, and it starts in Q4 of this year. So that's October 1st. So how is the new requirement different from Hrh Cur? So if you have been reporting to Hrh Cur in the past, you will know that you can aggregate the number of staff and enter an aggregated number. In the new reporting requirement, you must enter individual level, and we're collecting FTE, which stands for full-time equivalents. Similarly, in Hrh Cur, there is a limited list of what are called cotters, which are groups of staff, so clinical, lay, laboratory, etc. In the new requirement, you'll see that we have an extensive list of cotter categories, which are called employment titles. Hrh Cur, we are a limited set of staff that we are collecting information on. In the new requirement, we're collecting data on all PEPFAR funded staff across prime and sub-recipients. In Hrh Cur, we collect expenses on salary, stipend, and non-monetary. In the new requirement, we do collect the same salary, contract, stipend, and non-monetary amounts, but we're also collecting fringe. So we'll review that in a little bit as well. And then again, on the left, we're looking at alignment to datum hierarchies. This is when you report where the staff are located, where their work is located. And so then in the new inventory, you'll see that it's aligned to datum. And the most important thing is the new requirement has many more fields than Hrh Cur. So it's a much more in-depth inventory compared to the previous reporting requirement. So how does the new Hrh inventory align to expenditure reporting? And so I've listed out some bullets here, but essentially the employment titles are mapped, the mode of hiring match between the two data streams, the primary program areas match between the two, both inventories collect expenditure, and finally, they collect expenditure and fringe separately, which is the same as ER. So you'll see if you have worked with ER before, there are many similarities with the Hrh inventory, and there's this box at the bottom left that says connecting Hrh to ER. So keep an eye out for that during the slides. So you'll see that popping up and explaining where those connections exist. So what is the format of the reporting requirement? So it's an Excel-based template. The final versions of the template will be available October 1st within the new Hrh Datum app, and we will review later how to access the Hrh Datum app. There is one template submitted per mechanism and one entry, meaning one PEPFAR supported worker in the template per individual. So each row is one individual. And we recommend that you do not modify the Hrh template because it may cause problems when you go to upload into Datum. Because the next step after the Excel template is to upload into Datum, which is the right there. So those submitting or reviewing Hrh inventory templates will need to request an Hrh Datum account. And again, we'll review how to get an account later. And importantly, all data validation checks will be shown upon upload into Datum. They will not be corrected in the template. You will only see the errors when you upload into Datum, and we'll review that as well. So which mechanisms should report to the Hrh inventory? So all mechanisms that report to ER should report to the inventory. There's a pattern for this. So because both sub-recipients and prime should report, and they should all report on the same page, our recommendation is that the sub-recipients complete the template. They provide that template to the prime, and the prime consolidates the prime information as well as the sub-recipient data into one template and submits that one template per IM. And again, submitting means submitting the Excel-based template into Datum. So which individuals should be reported in the Hrh inventory? Every individual that receives any form of compensation from PEPFAR in the past fiscal year. So you can see this flow chart here. Again, did the individual receive any form of compensation in the past year? If they received salary, contract, or stipend, or non-monetary compensation only, they should be in the inventory. If they did not receive a form of PEPFAR compensation, they should not in the inventory. Here you can see the timeline. So we're currently prior to October 1st, so attending trainings and learning about the inventory. And what you need to do is request a Hrh Datum account. And again, we'll review how to do that at the end of the session. And then October 1st, the data collection will begin. And the data deadline is November 5th, followed by approval, which then the final approval is November 12th. And then we enter a data cleaning period. So if there are issues with the data, that's the time when they will be rectified. This matches other PEPFAR Q4 data streams. So if you have done other data streams before, this will look very familiar. So what do you need in order to complete the Hrh inventory? So you will need a copy of your OU specific Hrh inventory template. So again, that's available on Datum starting October 1st. You may have already seen a version, but there will be an official final version available. But all versions of the template will be accepted into Datum. You will need inventory guidance materials. So in addition to these webinars, there is also information on Datum Zendesk, and there's a link tagged there. You will need internal records such as HR and payroll, and you'll need program records that capture staff work and location. And lastly, you will need an Hrh Datum account. So you register for that at register.datum.org. And again, we will review that in a little bit. So now we have a couple of knowledge check questions before we shift over into the next section. So if you would like to put your answer in the chat box, which mechanisms need to report to the Hrh inventory? I see. Give everyone a minute if you'd like to write in or if you'd like to just think about it. So I see some answers. So yes, all. So all mechanisms that report in ER and that have expenditures associated with COP approvals need to report to the Hrh inventory. Excellent. Okay, so next up is what types of staff should be included. A, prime, and this is what type of staff should be included in the template. Prime partner, sub-recipient, program management, clinical and ancillary staff who deliver services, other staff who provide technical assistance and support non-service delivery activities, F, all of the above. I see some folks putting answers in the chat, excellent. So it's all, or F, all of the above. So all staff that receive some form of support should be reported. Healthcare workers, program management, TA, HQ-based staff charged directly to the IM. It applies to prime and sub. Excellent. So should staff working for the sub-recipient partners be reported in the Hrh inventory? Bit of a giveaway from last time. Excellent. I see some answers in the chat. So the answer is yes, all PEPFAR supported sub-recipient staff working for a mechanism should be reported. There should be one template submission per IM, which should include staffing information from the prime partner as well as any sub-recipients. So again, that slide that suggested that the subs would send the information to prime, consolidate it all together, and submit, again, one template per IM in Datum. Okay, last knowledge check. When does the new Hrh reporting requirement begin? October 1st, Q4. Excellent. So Q4, October 1st, 2021. It is a new annual reporting requirement, which is replacing Hrh. Excellent. Okay, so now we're going to move on to the next section, which is an overview of key Hrh inventory template data elements. And at the end of this, there will be our first Q&A. So just letting you all know, I see some folks putting questions up in the chat. So first, the Hrh Inventory Template. So it's an Excel-based template, so you can see a little cutout of what the template looks like. And there are two tabs. There's a cover sheet tab and a staff list tab. And each OU has its own Hrh Inventory Template. There's a guidance document. It's a PEPFAR handbook that has been released on Zendesk. So you can click that link there or look on Zendesk for that handbook. Each mechanism must submit one completed template. The template errors, again, will only appear upon upload to Datum. So throughout this presentation, I've highlighted some areas where you'll see possible errors. And so take a look. And again, remember, you'll only see the errors upon upload. So just be sure that you're focusing on the presentation, and then we'll talk about how to do that upload and how to check for errors in a little bit. Okay, so here's the first tab. So this tab is called the cover sheet tab. And you can see it contains information about completion date, who it's completed by, mechanism ID, etc. And so these elements must be completed by the prime for the final template submission to Datum. Sub-recipients may choose to complete this tab, but only the consolidated template with prime information must be submitted to Datum. Then the second tab, this is really the meat of the template. And so this is the staff list tab. And this second tab has, again, one row entry per staff member. You must complete all fields with the exception of the datum hierarchy, which is highlighted in the middle there in blue, record number, which is the first field, that is an optional field, and the comment section, which is the yellow all the way at the end. So again, those are optional. You must only choose from the drop-downs available. You may not write in additional text except for in the comments box. Excuse me. And again, we recommend that you do not modify the template. Again, if you modify the template, there's a chance you will have difficulty uploading it into Datum, causing more errors. So here's an ordered list of all of the elements. So if you attended the IP training last week, we went over every single one of these, but we do not have time for all of those today. So I've highlighted a few in bold that we're going to review again, and then we'll also do the walkthroughs with Jason in a little bit so you can see more detailed examples. So to start, we're going to talk about employment titles. So again, an employment title is what the staff member is doing. So when you come to this field, you can see there's a drop-down and you have to select the employment title for the individual you are reporting. So note that the job titles may not exactly match the official job title of the individual, but select the employment title that best describes the official job title of the individual. Again, each staff member should be in one row, and the drop-down list is alphabetical, and all titles are defined in the Hrh Inventory Handbook. So again, that's the handbook on Zendesk from OGAC, and so you can find a definition for every single one of these employment titles. So how should you determine the employment title for the worker? You should determine the employment title based on the work being done, not the training or qualification. So an example is a nurse who provides mentorship services and not nursing services should be reported in the template as a mentor, not as a nurse. So here you can see the organization of the employment titles. And you'll see as we move along, this is quite important. So, and this is also again linking HRH to ER. So the employment titles are there next to the dashes. So doctor, clinical officer, nurse, peer educator, peer navigator, expert client. Those are all employment titles, which means when you click on that drop down, this will be the options that you have. Each of these employment titles is categorized under a cost category. And so you can see these align to the ER cost categories. So you can see healthcare worker clinical, and then all of the employment titles that fall there, healthcare worker ancillary, all of the employment titles that fall there, and other staff, and all of the employment titles that fall there. So importantly, in the inventory, you only select this. So you just select an employment title, but it's important to know that that employment title is under one of these categories, and you'll see why later. Additionally, it's important to note that there are specific program management employment titles. So if you are reporting a program management staff, you must choose one of these employment titles here. There are 5. Okay, so a knowledge check. You have a medical doctor by training working for your program as a technical advisor for care and treatment. Should you select doctor or technical advisor as the employment title? Okay, I see mostly B for TA, so excellent. So again, it's based on, so technical advisor, and you should select an employment title based on the job the person is hired to do, not based on their education level or qualifications. Okay, so the next element we're going to talk about here is mode of hire. So mode of hire, there are only 3 options. So salary, contract, or non-monetary only. Salary is defined as PEPFAR funded compensation for workers who are employed by an IP and receive a salary or wage. Contract is defined as PEPFAR funded compensation through contract, or a worker who is not directly employed by an IP but contracted to perform services. And as an important note, contract includes stipend workers. And non-monetary only is a worker that only receives a non-monetary compensation. You must choose one of these. So if you have a worker that is both salaried and receiving a stipend, you should choose whichever has the higher value, so likely the salary. And then I'll show you a little bit later how you can report that small stipend amount that's attached. So again, you must choose only one of these, and the definitions are written out here. So the next element we're going to talk about is FTE. So FTE stands for full-time equivalents. And what you have to do when you come to this box is there is no dropdown. This is a numeric entry, and you have to enter the average percent of full-time equivalent worked by the individual. And so 0 would be no work, and 1 would be a full-time worker per month. So happily, there is an FTE calculator, which folks can use to help them with this process. And so I'm just going to switch my screen for a second, and we're going to review the FTE calculator. So just give me 1 second. So hopefully you can all see Excel now. If you cannot, please let me know. So it's another Excel-based tool. And so when you come to the top of the tool, you will see a set of instructions. So sorry, whoa. Okay, so the instructions here, it's the average FTE per month calculator tool for column H in the Hrh Inventory Template. Again, the column that says average FTE per month. So to use this calculator, there are 5 steps. So first, you choose the number of hours in a standard work week. It looks like I had actually already filled this out, but so normally when you come to this, it'll say 0. And so for the sake of our examples here, we're going to choose 40. But if your standard work week is 36, 32, 45, whatever it is, you can change this blue box here in 4C, and you can choose to reflect what is a standard full-time work week hours. So number 2, you have to choose which of the 4 options best represents your PEPFAR worker. So again, you're thinking about your PEPFAR worker, you need to know which of these fits them best. So the options are here, so you can see line 7, option 1, line 15, option 2, line 23, option 3, and line 34, option 4. And so we're going to do a couple of those reviews, but essentially you're going to choose which of those is best. And then step 3 here is you're going to enter values in the yellow boxes. So again, within that option, corresponding to generate the average monthly FTE. If your worker has no hours in that given week or month, please enter 0. Do not leave the box blank. And finally, you'll get your average monthly FTE. It'll show up in the green box, and that will be the number that you will enter into the Excel template for the Hrh inventory. So let's take a look at an example. So again, at the top here, we already entered 40. So our standard work week for our worker, for our example, is 40 hours per week. So let's look at option 2. So option 2 says the PEPFAR worker's hours generally remain constant per month. So an example here is a case manager works 50 hours every month. So if this is the case, we're going to enter 50 to this box here. It's going to generate an FTE. And again, it's going to generate an FTE out to 3 decimal places, which is the limit which you can enter into the template. So that's an important note. And so what you would do now, so you'd say, okay, the FTE for this worker who works 50 hours every month, 40 hours is a normal work week, FTE is 0.289. You would enter that on the template. Let's take a look at another one. So option 3. So this is a PEPFAR worker's hours are different per week in a month. So for example, data clerk works 40 hours for 3 weeks and 20 hours the last week of each month. So if that's the case, we have week 1, week 2, week 3, week 4 in a month. So we know that they worked 40 hours the first week, 40 hours the second week, 40 hours the third week, only 20 hours usually the fourth week. So the FTE for this person is 0.875. Okay, so that's our review of the FTE calculator. There's also examples 1 and 4, which we reviewed at the IP training last week. And so I'm going to switch back to the slides. I have all of the examples listed out, so you can also take a look. Let's see. Am I back at the slides? Can you see that now?
Perfect.
Anyone cannot? Please let me know. Okay, so this is, again, the FTE calculator. So we did our review. So here's what the FTE calculator looks like. And here is a set of examples. So you can see, again, we did example 2. So again, our answer was 0.289. And then example 3, the answer was 0.875. So you can run through these examples yourself. Note that, again, all of these examples are based on a 40-hour work week. If your worker normally has a different type of work week, you can change that by changing the blue box in the tool. Okay. So moving along, our next section is going to be about location of work for the staff. So the first question that comes up about that is, does the worker work in multiple sites? Roving staff. So what is a roving staff? So a roving staff is a PEPFAR supported worker who provides services at multiple facility sites on a regular basis. So you should enter no if the individual does not provide work at multiple facilities. You should enter yes if the individual does provide work at multiple facilities. Note that roving staff are only associated with site level program areas and should be reported to the PSNU level, and we'll review that shortly. So this gets us into the topic of datum hierarchy. So datum hierarchy, there are 3 different types of hierarchy for different types of countries, but they're all linked to linked in blue. So when you look at your template, you'll see this blue section, which is the datum hierarchy. In instances where individuals work at multiple locations, you should indicate where the majority of the work is performed. And you need to fill out the template starting from the largest hierarchy on the left down to the lowest. The hierarchy components in the template are OU, SNU, PSNU, community, and facility. We're going to define those now. So here's some key definitions. So OU stands for operating unit, which is usually the country or the region. SNU stands for subnational unit, and this is a smaller geographic area than OU. PSNU is a priority SNU, so the geographic unit level at which the PEPFAR program targets are set. Community is a geographic unit that is higher than facility and sometimes can be equal to PSNU. And facility is the lowest SNU in the datum hierarchy. So now we're going to look at an example, and we're going to use Malawi. So here you can see a cascade from OU to SNU1 to SNU2 to SNU3 to SNU4. There can be more SNUs than that, but this is what the hierarchy looks like in Malawi. So in Malawi, OU is Malawi. SNU3 is the PSNU, and it is also the community, so it is both. And SNU4 represents the facility. So when you go to look at the Malawi template, you'll see there is, again, OU was Malawi, so that was already determined. And now there's options for SNU1, SNU2, PSNU/community, and facility. The template columns are labeled with PSNU, community, and facility designations in all templates except for regional templates. So you don't need to know where your PSNU lies, but it's just a background for what that means and why it might be different on different countries' templates. So what you have to do is report the location of the work. So each entry must complete the datum hierarchy down to the appropriate level. And the appropriate level is based on the location of the work. So some examples of worker locations are international staff, military staff, above site workers, facility-based staff, etc. So you should determine the location of work based on where the work is performed and not the physical place of work, so not where the physical office is. So as an example, an above site program manager who sits at a desk in facility X but provides assistance to the entire SNU should be reported to the SNU, not the facility. So here is a chart provided by OGAC that displays the hierarchy, how the hierarchy should be completed for each type of worker. So again, the types of workers are across the top there in dark blue, and then you can see check marks indicating which columns in the inventory you should complete. So to make this a little bit simpler, I broke it down based on the type of template that you might have. And so we'll review this international worker in just a minute. So there are three types of datum hierarchy, which means this blue section will look different depending on your OU. So here are all the different options. So again, you can see where your OU falls, and there's three different types. So the first type is with a combined PSNU/community column. The second is with a PSNU and community column that are separate. And third, again, is the regional hierarchy columns. So if you have a PSNU/community column, so again, you're one of the OUs in that first row, first column, here you can see how you should report each type of worker. So it's fairly straightforward. If you have national military workers, you report to the high level here and you don't go any further. If you have a community worker, you say no to the does support multiple sites question, you answer yes to SNU1, you answer yes to PSNU/community. Only facility-based workers report down to the facility level. It gets a little bit more complicated if you have separate columns for PSNU and community. Essentially, it's the same as before, but the key difference is here. So the key difference is that community and roving staff only report to the PSNU level. So you do not report a community, even though you are reporting a community-based staff member. The only folks that report a community are the facility-based staff here at the bottom, and they report all the way down to the facility level. Lastly is the regional hierarchy. So again, regional hierarchy is very dependent on which country you're working on within that section. And so there is no specific designated PSNU column. But what you need to do is determine the facility level, the PSNU level, and then correspondingly complete based on where those staff are located. And so the international staff, again, there was a highlight before. If you have an international staff member, you should only complete the country, the regional hierarchy. For the other types of templates, do not include the international staff in the datum hierarchy. We will just know that it is Malawi or it is Lesotho, and you will just report that staff member and leave the datum hierarchy blank. Only if you are doing a regional hierarchy should you write down the country to which the international staff is located. Okay, so here's an example of an error you might get. So in this case, the person indicated that the worker is roving. So yes, the worker is working at multiple sites, but then they entered a facility. So this is incorrect. If you indicate that your staff member is roving, you must stop at the PSNU level. So again, they should have stopped here at column K, not gone down to L. Okay, so for a knowledge check, how should community workers answer the question, does staff work in or support multiple sites? A, yes, or B, no. Give folks a minute if they'd like to enter in the chat. So I think I tricked you guys. So community workers should answer no. So the only staff that should answer yes are roving staff. Community staff should answer no. Staff that are working only at the community and are not attached to any facilities should answer no. The question is intended to capture facility-based workers that move across multiple facilities. We can review that more in the Q&A session too, if that's helpful. Okay, so the next section here is primary program area. So there are different options for primary program area, and they are linked to what is listed in ER as well. So here are the options. So you can see there are site level program areas and above site level program areas, and you can see all of the options outlined here. And again, this is the same as the options in ER. And I highlighted here program management. If you are filling out this for a program management staff member, you must choose program management as their program area. So here's an overview of how you should choose program area. So again, you can see how the employment categories connect to program area. Remember, you already selected an employment title. And so if you chose doctor, that's a clinical title. Therefore, you must choose a site level program area, which is care and treatment, testing, socioeconomic, or prevention. If you chose a program management title, you then must choose above site program management as the program area. And so again, you can go back to that earlier chart that shows you where each of the employment titles fall into each of these categories. Here also is a chart that reviews how the location of work is tied to program area. So if you have an above site worker, you must choose an above site program area. If you have a community, roving staff, or facility, again, only the roving staff would say yes to that question about whether or not staff are roving. You must choose a site level program area. And when you look at program area, it will say above site : and then the name. So you'll be able to know if it's above site or site level. So a reminder, you've already determined the location of work in the datum hierarchy section. Okay, so an error here is that someone has reported their worker down to the facility level, then they chose an above site program area. So that's no good. So someone that goes down to the facility site level has to choose a site level program area. So you'd have to go to that dropdown and choose a site level program area. An important note about primary program area. So if the PEPFAR supported worker works on more than one program area, you must choose a primary program area. So even if they work on more than one, choose a primary one. But you must report the FTE and expenditure for the entire worker, not just for the primary program area. So as an example, you're reporting a full-time nurse who spends 3/4 of her time on care and treatment and 1/4 of her time on testing. Her total expenditure is $2,500. So the way you would report this worker in the template is you would say her primary program area is care and treatment, again, because she's 3/4 of her time there. Her FTE is 1 because she is a full-time nurse, and her expenditure is $2,500. Okay, so the next element here is service delivery, non-service delivery. So service delivery is defined as program activities involving direct interaction with beneficiaries, and non-service delivery are program activities that support, facilitate, or strengthen the facility, site, service provider, or subnational unit or national system. There's more information here, but I'm looking at the time and I want to make sure we get to our walkthroughs. So that's why I'm skipping some of the content on the slides, but the slides will be provided at the end. So here is how you connect service delivery or non-service delivery to the other elements we've already completed. So you can see the stars here show you have already selected an employment title, and the employment title falls into one of these categories, and you've already selected a program area. And so depending on what you've selected in column 1 and column 2 determines what you must select in column 3 here, service delivery, non-service delivery. So if you chose a doctor who is a clinical worker, then you must have chosen a site program area, and you must choose direct service delivery. If you chose a peer educator who is an ancillary worker, you must choose a site level program area, you must choose direct service delivery. So you can use these tables as you're going through depending on the type of worker, and this will help prevent errors when you go to upload into Datum. So again, here's an error. So in this case, someone chose a primary program area as above site, they chose direct service delivery. So again, if you chose above site, so if we go back here, all of the above site program areas are tagged to non-service delivery. So in this case, this would be an error. You have to switch it to non-service delivery. Okay, so our next and final section is about expenditure. So the template collects expenditure, and this is the same as ER. So expenditure is how much was spent in the last fiscal year on the PEPFAR supported worker. The HRH inventory does not collect an annual salary. The HRH inventory collects expenditure in 2 columns. The 2 column titles are sum of annual PEPFAR expenditure excluding fringe and annual PEPFAR fringe expenditure. And we're going to go over each of those categories now. So this is the first one. So again, sum of annual PEPFAR expenditure excluding fringe. And here you want to enter the total amount expended on the individual staff's compensation, excluding fringe and non-monetary expenditure over the past fiscal year. It is a free text box. And there's some other details here. Remember, it has to be in US dollars. And again, it's the expenditure from September 30th of 2020 to October 1st of 2021. The next box is annual PEPFAR fringe expenditure. So again, here you're going to enter the total amount expended on individual staff's fringe benefits, including non-monetary expenditures in US dollars. Again, it is free text, and we're going to review what this means in more detail in just a minute. Oh, pardon me. So here you can see what is included and what is excluded in fringe. So included costs are non-monetary costs, fringe benefits in the form of regular compensation paid to employees, fringe benefits in the form of employer contributions, and other allowable costs for fringe benefits. What is not excluded, so do not include stipends, cash awards, or bonuses, that went in the previous category. The PEPFAR funding for construction or renovation, cost of fringe benefits that were classified as indirect. And so one slide we have here is to clarify, what does non-monetary compensation mean? So non-monetary compensation includes anything purchased for the purpose of incentivizing work. Non-monetary does not include supplies or other resources required for fulfilling job duties. So you can see here what's included is purchasing household goods or clothing for personal use. What is not included is gumboots, bicycles, or other supplies intended to be used to perform work. What is included, airtime that the individual exclusively for personal use. What is not included is airtime for individuals that require airtime to perform their work. And lastly, what is included is purchase of travel for personal use. What's not included is reimbursement for travel for the purpose of traveling to a work site. And again, note that all non-monetary compensation estimates should be reported in the annual PEPFAR fringe expenditure column, and we're going to review that right now. So here I have, there's going to be 3 slides in a row, and each of these slides explains one of the modes of hiring. So if you remember from the beginning, there were 3 modes of hiring: salary, contract, and non-monetary. And so I'm going to give you some examples of how you should report that staff member. So here you can see a staffing scenario for salaried workers. So the first example here is someone that's just salaried. A salaried worker, so it means you should choose salary as their mode of hire. In the first column, column T, you should enter in their salary expenditure. In the fringe column, you should enter their fringe expenditure. If there is no fringe expenditure, enter 0. Salaried workers must have a numeric value in the fringe column. So say you're a salaried, number 2 here, say you're a salaried worker receiving an additional smaller stipend. Again, because the stipend is smaller, you're still choosing salary as the mode of hire. Then when you come to the expenditure column, the first one, you're going to enter the salary expenditure, and you're going to add to that the additional stipend expenditure. Again, you're going to enter the fringe, or if there's no fringe, enter 0. The last example here, number 3. So you're a salaried worker receiving an additional non-monetary amount. You're still going to choose mode of hiring is salary. You're going to enter the salary expenditure in the first column here. And in the second column, you're going to enter fringe expenditure plus the non-monetary compensation estimate. Here we have the same sort of examples, but for contracted workers. So if you are a contract worker or a stipend worker, so examples 1 or 2, you're going to enter the contract as the mode of hiring, and you're going to enter the expenditure. So if you're contract, you're going to enter the contract expenditure. If you're stipend, you're going to enter the stipend expenditure. You do not need to enter fringe if there is no fringe. That's why there is dashed lines here. Example 3 is a contract worker who is receiving a fringe benefit. So again, you're going to enter contract into mode of hiring. You're going to enter the contract expenditure. You're going to enter the fringe expenditure in the fringe column. The final example here, number 4, is a stipend worker receiving non-monetary compensation. You're going to enter contract into mode of hiring. You're going to enter stipend expenditure. And then in the fringe column, you're going to enter non-monetary compensation estimate. And the last example here is a non-monetary worker only. So again, if you are receiving non-monetary and also a stipend, like example 4 here, you're still choosing contract, entering the non-monetary here. Non-monetary only is you receive no other form of compensation except for a non-monetary compensation. And so you're going to enter the mode of hiring is going to be non-monetary only. You're not going to enter anything for expenditure because they don't receive anything besides non-monetary. And then in the fringe column, you're going to enter non-monetary compensation estimate. Okay, so that is it for the overview section. Sorry, we went a little bit long, but now I'm going to turn it over to Geraldine, who's going to moderate a brief Q&A. Then we're going to switch into some more examples where there'll be more opportunities for Q&A, and we are collecting all of the questions.
Okay, thank you, Sarah. And thanks everyone who's been putting questions into the Q&A section of Zoom. We've been keeping a list of the questions we want to go through now. So I know this is a lot of information that we just went through, and we'll answer some questions now, but we're also going to go through some specific examples to use the template and show how you enter people in based on different scenarios. And some of those things will help make it a little bit more clear, because we've just discussed all the elements in general right now, and then we'll go through some examples of how to fill it in to help it be a little bit clearer. So the main couple questions we've received so far, there were a few things that are related to timeline of the reporting. So one question was about when it starts. So it starts in Q4 of FY21. So it's aligned with the Q4 reporting for this year, to clarify. And one question was, is this report for the entire year of FY20? And related to that, do we report staff who were in the job and who left within this last year? So yes, so it's for FY21 specifically, and it covers all of this last fiscal year. So people that worked within this last year, even if they only worked for a portion of the year, should be reported in the template. Sarah, do you have anything to add there?
Nope, that sounds good. Thanks, Jalen.
Okay. There's some more questions about the types of materials that are available, so we can talk about that as we move forward, the types of support materials available. There was a question on where do headquarters or international staff fit into the hierarchy, related to when you went through the datum hierarchy question. So you showed that on one slide, but basically, can you explain how international staff are reported?
Sure. So if you're reporting an international staff member and you are not a regional template, which is, there's only 3 regional templates, you're just going to enter all the information about the staff member. But when you come to the datum hierarchy section, you're just going to leave it blank. And so that's how we'll know that it's an international level worker. So if you're filling out the Malawi template and you enter in the information about that staff member and you leave the datum hierarchy section blank, we'll know, okay, that's the information about this international worker. If you're filling out a regional template, you do want to select in country. So when you're looking at a regional template, the first column in the datum hierarchy, that blue section, that's going to be which country. And so please indicate which country the international worker is working in, and that will help us identify them.
Great. Okay. There was a question when we went through program area about what about people doing different services. So you showed this in your example, but basically if someone is doing, providing different types of work, like in the example you showed where a nurse is spending 3/4 of her time on care and treatment, but 1/4 of the time on testing, you report the primary program area that the person is working as. So in that case, you report care and treatment as the primary program area, even though we know they might be working on multiple things, but you choose the one that they spend the most of their time on. There was another question about the FTE calculator and asking if that's applicable for all, I think it was all categories of workers. So yes, you can use that Excel tool to help calculate the right amount of FTE that you should enter, regardless of what type of work the person is doing. And you can use the different categories that Sarah showed to help you understand, based on people's work schedule. Sometimes people might work a very set schedule. Every week is the same. Sometimes they might work a flexible schedule. So they work maybe the same number of hours per month, but it changes week to week. Or maybe people have very flexible, very seasonal schedules where they're not working for portions of the year, but they are working for other portions of the year. The different scenarios that are in that calculator are designed to provide options to help answer how much FTE you should answer for that person based on how much they work across time. And there is another question about how it would be helpful to know the built-in logic in Datum so that we can run quality checks before we upload. Sarah, could you explain a little bit about what's in the handbook from OGAC for the inventory related to quality, these quality checks?
Sure. So the template itself will determine if you have a valid OU. So I apologize, I removed that slide from this deck. But so valid just means that the facility is within the community, is within the PSNU, is within the SNU, right? So that's just like moving down the line, and it'll tell you at the end valid or not valid in the template. So if you get an invalid OU, you definitely have to change that. However, the template will not tell you about any issues with the location of work. So again, if you're a roving staff or a community level staff, you have to report only to the PSNU level. And so those kinds of triggers you won't see until you upload into Datum. So that's why you need to be careful to look at those charts that I laid out and how you should report the staff. But again, the Datum hierarchy itself, you shouldn't have any issue finding a PSNU within the larger SNU because it will tell you valid at the end of the line.
Okay, great. Thanks, Sarah. So I think we'll pause now and please continue to enter in questions. We'll stop again throughout the presentation to go through questions. So if you have other questions that come up, put them into the Q&A box. And now we'll go to Jason, who's going to go through some examples and show a demo of how to enter in people into the template with different staffing scenarios. Over to you, Jason. Thank you.
Great, thank you very much, Geraldine. And if we could move to the next slide, please. Hi, good morning, good afternoon, good evening, everyone. My name is Jason Rothenbender, and I'm a social scientist in the Health Workforce Branch. Thank you very much, Sarah, for the excellent overview of the HRH inventory tool, definitions, and submission process. I know we covered a lot of terms and definitions already, and we broke it down into many different pieces. But in this next session of the training, we're really trying to focus on how we actually use the HRH inventory Excel tool. Let's work through 6 different scenarios, see how we'll fill everything out, and really try to put the previous slides and parts of the presentation into practice. So the aim of this section is really to highlight several different types of staff, different roles, different hiring mechanisms, and employment scenarios, so we all have a little bit of practice completing the data submission tool. I'm going to request to share my screen. And we should be able to see the Excel template now. If I can no longer see the chat, so Geraldine or someone interrupt if it's not displaying. But this is the Excel template, and I'll zoom in a moment when we get to the staffing sheet. But as Sarah presented, this is a cover. There we have instructions and a cover sheet for each mechanism, and then the staff list, which is what we'll be filling out. And these are the same headings that Sarah outlined with her screenshots. And now we'll put it into practice with a couple different scenarios. If she hasn't already, Geraldine, would you mind copy pasting the first scenario? And we can read it together, and then we'll think about how can we fill out this template. And let me zoom in, as I said earlier. The first scenario is a female nurse works full-time during the year at one IP-supported facility. She was hired at the start of the year to provide HIV care and treatment services and is paid her salary directly by the prime implementing partner. In the past year, she was asked to divert some of her time to focus on COVID testing. Her total salary expenditure over the 12 months was $11,000 US, and her annual fringe expenditure totaled $1,820 US. So this template that I've downloaded is for Kenya. And let's say as an example
Jason,
for this example,
someone's asking quickly if you could zoom in maybe one more level on the template.
Yes, of course. Yes, thank you, Geraldine.
Okay, perfect.
So let's use Kenya as an example, and the facility is St. Elizabeth Chiga Health Center. So let's actually just navigate through the entire process at first. So the record number is an optional category, as Sarah mentioned. You don't need to fill it out. And one thing that we do want to note is under no circumstances should PII or personally identifiable information ever be entered into this category. We recommend not filling it out. But sex, if you look back to the scenario, this is a female nurse, so female. Employment title is a nurse, so we'll scroll down to nurse. Employed through the prime or sub-IP. We said that she was paid her salary directly by the prime implementing partner, so prime. The mode of hire, salary. Is this nurse seconded to the Ministry of Health? We don't have any mention of that in this scenario, and so we will say no. Months of work in the past year. We noticed that she was hired at the start of the year, so she worked for 12 months in the past year, and she's full-time, so the average FTE per month, this one's easy, no calculator needed, 1. And does this individual work in or support multiple sites? No, it's a single facility. I want St. Elizabeth Chiga Health Center. So now, given that this is a facility-based in a single facility.
Hey, Jason, sorry
Yes.
to jump in. It looks like it accidentally ticked yes instead of no. And you said it's just one
Okay,
facility,
thank
right?
you. Yeah,
Perfect.
it's always important to have quality control. And I know not everyone can have all the eyes looking, but it certainly is helpful for me. So thank you very much, Geraldine. And so yes, no, so we're not in multiple sites, we're at a single site. And because it's a single site facility, we need to go down all the way down to the facility level in the org hierarchy. So the PSNU level for Kenya is the county level. And so we will select Kisumu. So Western Kenya. Then it's in Kisumu East. I believe it's Colwell East Ward. And then the facility is St. Elizabeth Chiga Health Center. And so I know that St. Elizabeth Chiga Health Center is in Colwell East Ward, in Kisumu East, in Kisumu. So I just navigate all the way down into the facility level for the single facility. The primary program area. Well, we have an individual facility, so we know it's site level. And which of these site levels should we look at? I think it's care and treatment. Does this nurse deliver services directly to beneficiaries? Yes, it's direct service delivery. In the past year, provided support for the COVID response? Yes, she was asked to divert some of her time to focus on COVID testing. The sum of annual PEPFAR expenditure excluding fringe? Well, we know she worked for 12 months and her salary that she was paid over those entire 12 months was $11,000 US. And the fringe for that same period of time was $1,820. And so this is how I would enter all the information using the, for that individual, for this nurse at that site for this implementing partner. If we could add that second part, if it hasn't been added already, the follow-up, Geraldine. But a quick follow-up is, what if the IP had hired a total of 10 female nurses at the same time for the same salary, but 3 worked at a separate facility? Well, we could enter all of this stuff manually, so we would have a total of 10 rows here. Another option is, if we wanted to, we could copy paste this in the tool. This tool does allow you to copy paste. So we can do the total of 10. How many do we have right now? 9, one more. And if I said 3 work at a separate facility, so we would need to make sure that we correctly identified the separate facility. I know it's a dispensary, but let's just say, change that to a separate facility. So it's a little bit of a shortcut, but we want to make sure that we're having a new row for every individual. And there are some ways where if we know we've got the same staff with the same information, we can just copy paste it. Or if it's the same staff with similar information, we can copy paste and then just make a few of those changes. So moving forward, I'm going to scenario 2. And this is a staff member working at multiple facilities. So a female nurse provides care and treatment services and works full-time supporting multiple facilities. She was hired halfway throughout the year. Her salary is paid directly by the prime implementing partner. In the past year, she helped screen and test clients for COVID with part of her time. Her annual salary would be $11,000 for 12 months. Her total salary expenditure over the period she worked was $5,500, and her fringe expenditures totaled $935. So how might we enter that? Well, again, we're going to leave the record number, which is optional. We'll leave that blank for this example. So it's female. Again, it's a nurse. She's paid directly by the prime implementing partner, so we'll do prime. And she's salaried. There's no mention of being seconded to the Ministry of Health, so we'll select no. Months of work in the past year. Well, the scenario says she was hired halfway throughout the year. So she was only working for 6 of the 12 months. The average FTE per month, well, she's full-time, so that's will stay as 1. I'm sorry, this jumps down a little bit. I'm very zoomed in to make sure it shows on the screen. Does she work in or support multiple sites roving staff? Yes. And for this, because it's roving staff, we only go down to the PSNU level. And as Sarah mentioned, for these OU files, the PSNU and the facility, all these levels are labeled for the OU files right at the top in the first row. So we only need to go down to the PSNU level. And let's say again, it's Kasumu, just to show some slight differences. It's as far as we need to go. Program area, again, site level care and treatment. Direct service delivery, yes. In the past year, we said in the past year, she helped screen and test clients for COVID, so that would be yes. And this is something that gets interesting now when we're looking at the sum of annual PEPFAR expenditures excluding fringe. Her salary would be $11,000 a year. However, she only worked for 6 months of the year, and she was only paid $5,500. So the sum of her annual PEPFAR expenditure excluding fringe is $5,500. And the fringe expenditure is $935. So it's not their salary rate for the entire year, it's what they were actually paid for how many months they were working. We're going to go to a third scenario. If we wouldn't mind copy pasting scenario 3 into the chat. And I kind of want to I want to keep these headings there. So let me, okay, that was a mistake. Okay. We'll just keep going. We'll keep going down. A sub-IP provides pre-test counseling, testing, and post-test counseling services through mobile community-based testing. The sub-IP hires 10 testing and counseling providers, 5 men and 5 women. Each of the 10 staff are hired through contracts that pay them $2,850 each for 6 months of full-time work. There's no fringe with this contract. So we know we've got 5 female and 5 male. So let's start with the male just to break it up from the previous list. The role, what's our employment title? Let's go down to testing and counseling provider. Is it prime or sub-IP? Well, it says a sub-IP in this scenario, so we'll go sub. And we say it's a contract, not salary. We have no indication they're seconded to the Ministry of Health. The months in the previous year, we say it's 6 months of full-time work, so 6 months and 1 FTE. And are they at multiple facilities? And this is important. Work in or support multiple sites? The answer to this is no. They're community-based, but they're not in a facility. So they're working throughout the community, but not at specific facilities. So therefore, they are not roving staff. And if that's the case, we only report them down to the PSNU level. I'm sorry for bouncing around, or I want to keep it zoomed in for everyone. So, well, let's just say, maybe this is Mombasa. Let's see what we can do. Yeah. Beach. I'm going to scroll down. And we know this is site level testing. So we know it's site level. We'll select testing. This is direct service delivery. We don't have any indication that they were supporting COVID. Scrolling up, we know the sum of their annual PEPFAR expenditures, excluding fringe, was $2,850. And we know there was no fringe because it's with these contracts. So again, using the trick that we learned earlier for copying and pasting, I could either just re-enter this 4 more times for male and then 5 times for female, or I could just copy paste. And then this time I'll change to female and make sure there's 5 female. And there we have it. We have 1 row per individual, and we've navigated all the different categories that Sarah outlined in her slides in her presentation. And another thing, I know it's been asked and addressed several times in the chat. 1, yes, this recording of this presentation and the PowerPoint slides will be available after the presentation. And 2, there are many tables in the HRH Inventory Handbook that's been made available by SGAC that outline all the definitions for this. For these different categories and how far down in the org hierarchy or the SNU levels we need to go for each type of entry. In addition, we're definitely documenting the questions we're seeing in this chat and in a previous training, and we're working on frequently asked questions documents. So if there are points of confusion that or areas that we need to clarify, we're documenting those and making sure that's available too. So I'd like to stop sharing now.
Jason?
Yes.
Sorry, before you switch out, 2 more tricks. So 1, if you highlight that top row, let's see, I think everyone should be able to do it. So the very first row, row 1. You click view up at the top. And freeze top row.
Yeah.
I think folks will be able to make that adjustment if they want on their template, and that will allow them to be able to see as they're scrolling. And one other quick trick for the template is, so if you highlight, for example, if you go back to the scroll away to the bottom. So Jason showed copy and paste. Another option is if you highlight female, that very last female option, and then go to the bottom right corner, you get like a little black plus. Yep, you can just drag. So that's another option, and you can highlight more than 1 row as well. So you can highlight like testing and also, and then do that. And you can also drag that way. Just as it's very similar to copy and paste, but just as another method. So,
I think,
did you want to?
what Sarah's really highlighting is that copying and pasting and those click and drags will not damage the tool as long as we're keeping the integrity of the columns as the same and filling out the rows appropriately. We can copy paste and we can click and drag and do some of those common sort of Excel tricks. So I'm going to thank you very much, Sarah. So I'm going to stop sharing, and we're going to go over the rest of the examples back on the PowerPoint. And those of you that were in the training last week, you'll notice some adjustments have been made to definitely these first couple scenarios, but we made some tweaks to highlight some different aspects of data entry and also to just provide additional examples for everyone. So if we can scroll now to scenario D, please. So let's read this example together about non-service delivery at multiple facilities. A female data entry clerk works full-time on prep data entry between 3 facilities. She was hired at the start of Q2 and receives a salary which is paid through the Prime IP. In the past year, she did not provide support for the COVID response. She has an annual salary of $4,500 US. Since she was hired 3 months after the start of the year, oh, that was a bit of an error. It says she earned $4,500 for the 9 months she worked. Her annual PEPFAR fringe expenditure for those 9 months is $600. Well, we'll get to that in a moment, but let's answer the first couple categories. So first, you see on the table on the right that the these correspond to the first column is the column headings in the tool, and we've just selected the responses here without, just to provide those answers, so we don't need to work through the Excel tool. So the record number is optional, and again, we want to highlight, we recommend not filling out this record number, but if you are using it, under no circumstances should be using personally identifiable information. Sex is female. The employment title in the pull-down menu is a data entry clerk. So employed through the prime, and salaried. There's no information on being seconded to the Ministry of Health, so we would select no. Months of work in the past year is 9, and the average FTE per month is one. So we know that she was hired at the beginning of Q2, so she was employed for Q2, Q3, Q4, which is 9 months of the year. Does she work in or support multiple sites? Yes. So what SNU level do we report to? Well, because it's supporting multiple sites, we know we go down to the SNU level. I'm sorry, the PSNU level. Can we scroll to the next slide, please? In the primary program area, again, it's site level, so it's prevention and prep. It is non-service delivery. We don't have any information about in the past year whether or not she provided support for the COVID response. Now, this is where there's a little bit of a typo, which we'll clean up in the final PowerPoint presentation. Her annual salary was $4,500, but she only worked for 9 months of the year. She was hired at the beginning of Q2. So in that case, the salary she was actually paid was $3,600. So the sum of annual PEPFAR expenditures, excluding fringe, was $3,600, which is 75% of $4,500. And the annual PEPFAR fringe expenditure is $600. Can we go to the next slide, please? In scenario E, we have an example of program management that's above site. A female senior finance officer manages program funds, oversees project audits, as well as financial and administrative reporting requirements. She works at the implementing partner office in the capital, but the program is implemented across 15 sites across the country. She works full-time for the entire year, and her salary expenditure was $37,200 US. Her fringe expenditure totals $6,800 US. So record number will leave blank. Sex is female. The employment title is finance staff. She's employed through the prime partner. She's salaried. No information on being seconded to the ministry, so we'll say no for that. She's worked the entire year, full-time for the entire year, so it's 12 months in the past year, 1.0 average FTE per month. She does not work in multiple sites, is not roving staff. So what level do we need to report geographically? Only need to report at SNU 1. And if we go to the next slide, the primary program area is above site program management. This is non-service delivery. We have no information on supporting the COVID response. And the sum of her annual PEPFAR expenditure is $37,200, and the annual PEPFAR fringe expenditure is $6,800. And again, I know we go through these answers rather quickly about what level do we report in the SNU, what category do we select for primary program area, what option do we select for employment type. And I just want to reiterate again that in the handbook, there are tables and outlines for each of these categories and definitions, really flow charts for what level in the geography you need to drill down to, for what the definitions are for program area and employment type. So please use those as references. If we go to the next slide, please. For the final example, we have an HRH advisor who is seconded to the Ministry of Health. So a female HRH advisor is employed through a prime partner and seconded to the Ministry of Health to support the development of a new national HRH strategy. She works at the Ministry of Health office in the capital city. She works full-time for the entire year, and her salary was $31,400 US. Her fringe expenditure totaled $5,430 US. So we left record number blank. Sex is female. Employment title is technical advisor. She's employed through the prime, has a salary, is seconded to the Ministry of Health, so we would select yes. She's worked full-time the entire year, so 12 months of work in the past year with a 1.0 or full-time FTE average per month. She does not work in or support multiple sites. So the SNU level that we would report for her is the SNU 1 level. Next slide, please. The primary program area is above site human resources for health. She's non-service delivery. We have no information about providing support for the COVID response. And the sum of her annual PEPFAR expenditure, excluding fringe, is $31,400. And the annual PEPFAR fringe expenditure is $5,430. So I'll pause right there. Well, I think we have a knowledge check right after this slide. And I haven't looked yet, but in the previous training, we get a number of different sort of what ifs and other examples, and we'll navigate through some of those, as part of this presentation, but a lot of them will also include in subsequent materials or frequently asked questions if we're getting those questions often enough. So I'll stop there. Maybe we can transition to the knowledge check, and then we can see what questions we might have. I got ahead of myself. We do have one more slide that I want to just reiterate, and I think all of these points were made in Sarah's slides, but as a reminder, for international workers, such as US-based staff that spend a portion of their time in country, we leave all the geographic hierarchy columns blank. And as Sarah did mention, for regions, the SNU1 level is the country level, and that's where the worker performs their work. For military, we only select the military SNU, leave all other geographic hierarchy columns blank. I noticed for many of the partners who submitting MRR indicators in Datum, it follows that same org hierarchy that you're navigating to get to the site level or above site level for your data entry for other MRR data. This is just an Excel-based version of that. And for roving staff, working in multiple facilities, you should leave all geographies below the PSNU level blank. For community workers, just working in a community but not in individual facilities, should leave all geographies below the PSNU level blank. Above site workers must leave the facility level blank. Staff assigned to a facility that spend a portion of their time in the community should be entered at the facility to which they are assigned. Now I think we can transition to the knowledge check. And maybe I'll ask this question, and please enter some of your responses in the chat. You employ a facility administrator who supervises staff and manages workflow, but does not see clients directly. Would this person be reported as service delivery or non-service delivery? Correct. I've seen some of the chats pop up at the bottom of my screen, and it's all B, which is correct. Non-service delivery. This person is not directly providing services to clients. We'll navigate to Geraldine turn over to Geraldine for a Q&A session.
Okay, great. Thank you, Jason, for going through the examples. Okay. First thing I'll note before we go into some of the questions that have come in during the section is, as Susan mentioned at the beginning, this webinar is going to be held in French. I believe it's on October 6th, but coming up in the next couple of weeks. And so there will be additional examples and questions, things that can be gone through on that webinar in French, if that's helpful to you. There were a few questions, Jason. There was a question about one of the scenarios that you used that I wanted to ask back to you. So someone asked, starting Q2, would that mean they work for 6 months or 9 months? And how do you navigate like the amount of time they work for the year and the salary that you put in? Could you explain that a little bit more? So does starting Q2 mean that they start at the beginning of Q2? So they work for 9 months, or does that mean they only work for 6 months in the year? And then could you explain how to put in someone's compensation with how much time, like the amount of time in the year that they're working?
Sure, that's a great question. And we're trying to think about different ways to describe any of these scenarios. And our unit of time is really, if you look at the Excel sheet, it's really based on what's the months of work in the past year. So I used the way to describe that as they began in Q2. Perhaps I could have just said they started the 4th month of the year or something to that effect. But I thought about it in terms of if they started in Q2, then they were employed for all of Q2, Q3, and Q4, which would be 9 months. But really what's most important is to know how many months of work in the past year how many months in the past year were they working? And then for the expenditure and the salary, again, I really just wanted to draw that distinction, or we just really wanted to draw that distinction where if they worked in less than the entire year, we're really interested in how much they were actually paid. So they may have an annual salary rate, but if they weren't employed for 12 of the last 12 months, they didn't receive all of that. And so what we're interested in is what was the expenditure, what was the amount that was paid over the course of the previous year to that individual. So we just wanted to highlight a little bit of a distinction between what might be an average salary versus how much someone was paid. And for months or quarters or however you want to describe when they started, what's most critical in the tool is accurately reflecting the total number of months that they worked in the past year.
Great, thank you. There were also a few questions about the frequency of this reporting. So just some high-level information on that. This is intended to be an annually reported requirement from PEPFAR, which begins with the Q4 reporting for this year. So I know there were a couple comments on, the frequency and the usefulness of having more frequent staffing data, but for the time being, this is an annual only requirement, so it will be reported once per year. And then there were some questions about, who within your organization might you want to consider having be responsible for entering this information. So a few things to think about. There were a couple comments like, should this be done by someone in human resources for our organization? Should this be done by someone else? So some things to consider are you want people to be in charge of entering in this information who can know and have access to all of the details of the types of things that people are working on, as well as the compensation information. So because of the sensitive nature of the compensation information for staff, you may want to just consider carefully which staff members you want within your organization to be responsible for entering in this information, and making a plan internally for how you will collect and enter in the data into the template. There were also a few questions about if your organization has already started entering some of this data, because many of you may have already received the template for your country from the Human Resources for Health Points of Contact at the USAID mission in your country. So all of the templates that have been circulated that are this PEPFAR developed templates, those templates will be accepted into Datum. But just a note that on October 1st, the final versions for the template for your OU will be available in the HRH Datum app. But if you've received one already from someone in country that is for your OU and have already started entering information, you could either submit that template if it's the same template, or you could reformat the information to enter it into the new template if there's any slight changes once it's available on October 1st. And Sarah or Jason, do you guys have anything you want to add there on the templates and when to start entering information?
No, nothing to add from me, Geraldine.
Okay.
All set. The next section will review, the process of entering data into Datum.
Okay, great. Are there any other major questions we can address right now before we go into the next section about submitting to Datum? And that will go into more details about quality checks and things as well. Okay, I think we'll pause for there and move forward so that we can get to the rest of the content and more questions, but please continue entering your questions into the Q&A section of the Zoom. Thank you.
Excellent. Thank you, Geraldine, and thank you, Jason. So next up, we're going to review an overview of reporting in Datum. This is going to include how to get a Datum account. So first off, we have a review of the reporting timeline. So again, really the key pieces here are highlighted in red. So prior to October 1st, which is now, you need to obtain a Datum account. Then October 1st is when the data collection begins, and the data collection should be submitted by November 5th, at which time it will be approved, and the final deadline is November 12th. So here are the steps for how you can get to that submission. So the first step is to request an Hrh Datum account at register.datum.org, and we're going to review that in just a minute. Step 2 is then, once you have your account, is to log into datum.org and download your OU specific template, again, starting on October 1st. I want to reiterate that if you have a template from Mission POC or anyone, that a current template, that template will be accepted. You don't need to get the new one, but again, the final template will be available for download on Datum starting October 1st. Step 3 is complete the template. So that's a short step, but it is all the pieces that we previously reviewed in Jason's walkthrough and in my definitions of the different sections. Step 4, you're going to navigate to the HRH app in Datum and upload the template. So again, only one template is uploaded per mechanism, and I'll show you that again in just a minute. Step 5, you're going to correct any errors as indicated upon upload. So again, this is where I'm saying that there are no errors in the template itself. The only errors you will see are when you upload into Datum, and you will need to correct them all before it can be submitted for approval. So again, once you correct any of your errors, you now move to the Datum Approval app. And again, I'll show you what this looks like in just a minute, and click Submit to fully submit the template for Datum and USAID approval. And then you await template approval and make any revisions as requested. And again, the deadline for uploading the data, we're going to go back one slide, is November 5th, and the deadline for the approval is November 12th. Okay. So requesting a Datum, requesting an HRH Datum account. So the Hrh Inventory Processor will be a new application and data stream within Datum. In order to submit, approve, or interact with the Hrh Inventory application, existing Datum user accounts need to update their account, or new accounts need to be created. We recommend that you request an account between now and October 1st, but you can request an account after October 1st. The reason we're suggesting you get the account before October 1st is because that will be the time when you will be able to download the final template and work with the system. So we think it's critical to have it now, but again, you can request after October 1st if necessary. So you're going to see the following slides, and I'm actually just going to come out of the screen and share the page. So it's we'll skip to the first slide here, and so it's register.datum.org, and let me just pull that up 1 second. So you should be able to see register.datum.org. If you are not able to see that, someone please let me know. And so when you go to this page, this is the little form that will show up. And you can see there's 2 options here at the top. So there's request a user account on Datum, and there is contact my Datum user administrator about something else. So if you do not have a Datum account, you are going to request a user account on Datum. So that means you should select this first dot, which is currently selected. Then you're going to enter. So my name is Sarah, and my last name is Ackerman, and my email address, whatever it would be. That's not my email address. And then you are an implementing partner. So you're going to select implementing partner. You'll see when you do that, it's going to make a larger set of options here. And so you're an implementing partner. So you're going to come here and you're going to choose your OU. So let's say you're Ethiopia. You're going to write down a name. We're just going to write name. You're going to choose your preferred language. You're going to write, you're going to write that you want HRH. This is the place, if you do also want ER access or anything else, you can also select it. So see here, I can select both. Again, if you're looking for an HRH app, you need to select HRH. For access type, you're going to choose both data entry, Hrh inventory, as well as submit data. Because again, as a partner, you're going to be submitting the data. And again, you must submit 1 template per mechanism. And then, are you requesting this on behalf of someone else? Yes or no, if you are or not. And finally, you can say, so maybe Hrh POC for new inventory, or whatever justification you'd like to put there, but explaining why it is that you need this account. So then you would click submit. I am not going to click submit because this has an email that is not correct, but you would click submit, and then you should receive an email that tells you about the process and then about your new account. So again, that's if you do not have a Datum account. If you already have a Datum account, you're going to select this button here, which is going to say contact my Datum user administrator about something else. Again, it kept my name and my email and everything like that. You type in your own information. And then in user type, again, you're still implementing partner. Operating unit, you could switch to Kenya. Again, name, you choose a name. And in this box, you are going to say, please update my Datum account for HRH app access. Something like that. Explain to them that you need access to the HRH app. And I might also add for uploading data to explain that, they should know because you're a partner that you're uploading data, but just make it clear. And so again, you're going to click submit. Again, it will start the process. So you should get an email. Someone's saying in the chat that they can't see the Datum page. Sorry, can you see it now? Okay, I apologize.
Now we can see it.
Okay, sorry. So going back, so the two options here are request a new user account on Datum. So again, here is you write your name and your email address. You choose implementing partner, you choose the information. Again, you want to choose HRH and data entry as well as submit data. Sorry about that. I didn't realize you guys could not see. And again, you're writing your justification here. You would click submit. If you already have an account, you clicked contact my Datum user administrator about something else. You enter your name and your email address. You say that you're an implementing partner. And then in the text box here, you explain that you want to update your Datum account for HRH app access. And you can say for uploading data. Okay, sorry about that. I didn't realize you couldn't see. I'm going to switch back, but there is also a screenshot, which I'm sure you could see on the other side. So let me switch back just 1 second. So now you should be back on the slides. If you're not, please let me know. And so again, here's if you need a new account, and here again, highlighting where you need to go. And here is if you already have an account. So if you didn't see that, there's a description here on the left. Okay, so once you have your account, now you need to log into Datum. So the Datum account is www.datum.org. And so we're going to put in your new username and password or your old username and password, and you're going to now have access to the Hrh processor. So how do you get to the Hrh processor? You're going to click on these little 3x3 grid up here, and it's going to open your apps. Within your apps, within your apps, you should see the Hrh processor, which looks like this little Excel template with a $sign on it. So you're going to click on that, and it's going to take you to the Hrh processor. Now you're going to enter your operating unit. So in this case, South Africa. But of course, if you are not South Africa, choose the correct OU, choose the correct year, and choose the mechanism. And so you're going to select what is specific for your case. Then you're going to request the template. So again, you can see on the left here, it says South Africa, COP20, FY21. You can see over here in the highlighted in the red box, it says request template. So when you click on that, it will download the template to your laptop, or computer. So you can see here a box that it's saving it into, this person's saving it into downloads. Of course, you can save it wherever you need to. And this will be the Excel template that we've reviewed for the rest of this session. So here again is just a picture of it. So again, it has these two different tabs, the cover sheet and the staff list. So remember, you have to complete both tabs, cover sheet and staff list. To complete the template, you must follow the instructions outlined earlier in this presentation and in the Hrh Inventory Handbook. Again, I put a link there and it's on Datum Zendesk from OGAC. You must submit one template per mechanism. We recommend consolidating the sub-recipient staffing data together, having one person do that and add in the prime data and then submit that as one template per mechanism. So you completed this, no small task, but you've completed this, and now you're ready to upload it back into Datum for approval. So to do that, again, you're within Datum, the same page. So before you clicked over here on the right, which said request template, now you're going to click down here, which says upload template. The upload template is going to open a page which will let you choose from your computer which file to upload. And so you can see here, this is someone who's uploading a South Africa template. So they've clicked on that, I'm going to click open, and it will upload the template into Datum. So this is step 6, but it's uploading the template, but you're not done once you've uploaded the template. What happens when you upload the template is you will see one of the following options. So up here, you will see success. That means there's no errors as indicated by Datum. So if that's the case, you would move forward. However, if you have an error in your template, this is where you will see the error. So you can see here, this is the number of the template, this is the title that they have, and then it says status, 1 error. So what you need to do is click on that error and Datum will provide you with a list of information about the error. So again, data quality validations are processed upon upload into Datum. These checks are logical or value checks. And again, we reviewed a lot of tables earlier that define how you must fill out the template. And if you do not follow the charts that we have laid out, you will likely get errors. And again, when that error shows, it will explain to you which row the error is in, and will also tell you what the error is. So importantly, the template can be uploaded as many times as needed to correct errors. And so what this means is that we recommend uploading the template early and often to catch errors. So this means you don't need to wait all the way until the end for the data upload. You can fill out 10 rows and upload, check for errors, and then take the template back down, or just have the template on your desktop and continue filling it out. Have 20 rows, upload, check, see how it's going, you know? And so the important thing there is that if you are making a continual error, so say for some reason accidentally you're always checking a box that shouldn't be checked. If you start uploading earlier, you'll be able to see that error and make that correction. And similarly, be able to tell other folks, the subrecipients, perhaps, hey, here's an error, you know, you need to make sure that you're making that adjustment. So again, we recommend uploading the templates early and often to catch errors. We recommend doing it well before the November 5th deadline, so that you have plenty of time to correct those errors. And then finally, the template must fully pass all validations before the IP is able to successfully submit. Also regarding check, this is within the handbook from OGAC. So this is a set of just high-level checks that you can go through when you're going to submit that final template that you're looking for approval. So again, looking for completeness, checking for logic, checking for duplicates, check for extreme values, and check for geography are just some key pieces to check for. So now finally, you have gotten a clear, which means that there are no more errors in your template. So now you need to finally submit the template for approval. So to do that, you go back to that 3x3 square with the apps. And within your app options, you choose Data Approval. So that's this green check mark here. Again, the Hrh Processor, the one to the left, that's what you were previously using. Now you're in the Data Approval app, so the green check mark. You go through that and you'll be able to see all the different templates, again, that have no errors that you are able to submit for approval. You select those, so you can see here they checked the one they want. In the red box here, you can see Submit. And once you do that, it is submitted and it is ready for review. And so you are all set. And if there is an issue with the template, or something needs to be changed, then you will be contacted and you will have to go back and take a look at the specific section that needs assistance. So that is it. So we have a knowledge check here or two, and then we have another Q&A after that for any questions. So knowledge check. When will you see error messages if something in the Hrh inventory template is entered incorrectly? A, immediately as you enter the data in the template. B, when you attempt to upload to Datum, you will see an error message. Or C, you will only be notified of errors after the submission has been reviewed by agency staff. So which of these, A, B, or C, is the correct answer? Awesome. I'm seeing a lot of B, which is the correct answer. So when you attempt to upload the template to Datum, that's when you will see the error messages. There are no error messages in the template itself. So again, it's why we recommend uploading early and often, so you can start to catch those errors early and make sure you make the appropriate adjustments. Okay, second question. Will Datum accept a template if there are outstanding error messages? Yes or no? Excellent. So the answer is no. So all error messages must be addressed by making changes to the data in the template before Datum will accept the submission. So again, you saw that page, the person who had uploaded had one error, so they would need to go in, find that error, correct it, and re-upload the template. So again, why we suggest to do this early, you may have more than one error, and so you want to make sure you have time to complete those errors, to correct those errors. Okay, so we're going to pause for another Q&A, and then we have just a couple wrap-up slides, and then we're all set with this training.
Okay, great. Thank you so much, Sarah. So we've had a couple more questions come in. Are there limits to how many individuals for an organization can have a Datum account or can download the templates? So do you want to respond to that, Sarah? But in short, I don't believe there is. I think you can have as many people in your organization as you want request access, and there's no limits on amounts of time you can download the template.
Yes, I don't think there's any limits. Again, one person has to be the person that uploads per mechanism, right? So that person certainly needs an account, but anyone can request and be able to take a look.
And I think one thing we would suggest is that you have several people from your organization request and get accounts. That way, in case someone is not feeling well or goes on leave around the time that you need to submit, that you have multiple people who have access and would be able to submit the template. Let's see, if this for either Sarah or Aaron, how long does it typically take for account requests to process once you've requested them?
So Aaron, feel free to cut in here. I think it's a fairly quick turnaround, but again, everyone needs to request this now. So the sooner you request it, I believe the better. And so that's why we're encouraging folks to do it now before October 1st. If you do have difficulty with it, for some reason you don't get an email or something like that, you can submit a Zendesk ticket. And so that's a question about it. That's not an account, it's a question. And I'll review where you can find that Zendesk ticket. Again, if you're having problems or you did submit your request, but you haven't heard anything back, you can do that as well.
Great. Are there, with the datum error checks that you were talking about, what type of information will datum tell you about that error? And will it tell you exactly where in the template to find the error when you try to submit it and it flags it as an error?
Sure, so it will tell you which row the error is located in, and then it will tell you information about the error. So for example, if you have checked that yes, the staff is roving, but you have reported down to the facility level, it will say something to the effect of, roving staff report to the PSNU. And so you'll have to go back in and you'll have to remove the facility and stop at the PSNU level. So the information is fairly detailed, but again, it's canned answers, as it were. So again, we recommend uploading the template early and often so you can see what those errors are. And if you do have questions about what it means, you can contact folks so they can help you with that.
Okay, great. Okay. Let's see. So there was a question about guidance on what about completing the inventory for projects that might be ending basically at the end of this fiscal year. And if reporting is supposed to start on October 1st for this last year, how are those programs supposed to manage and navigate? I can add some information here, and then Sarah or Aaron, feel free to jump in. My understanding is that the templates are available and are available now through your HRH point of contact at the mission and have been circulated. So if you have questions, if you know that you need to fill it out sooner because your project is going to be ending, I would follow up with your HRH point of contact at the mission to discuss a plan for submitting it early and then having it entered in to Datum during the Q4 reporting afterwards.
Makes sense to me. Erin, do you have anything to add?
No, nothing to add.
Let's see. A couple more questions about who might be responsible for the reporting, whether it's HR, finance, or program staff. And I think, as a couple people have noted, this is different type of data than a lot of the program data that your M&E staff usually deal with. So you may want to consider, maybe it makes sense for someone who handles expenditure reporting combined with someone from your HR team to work on this reporting requirement together. But you can discuss internally based on the type of data and the access needed, which types of staff from within your organization you would like to have be responsible for this reporting. Okay. And yes, we will be sharing the training and we'll be sharing the recording from today and the slides again afterwards. There were a few questions about the relationship between FTE and the compensation or expenditure on staff. So basically, how are we viewing that relationship? So basically, the FTE is the amount of full-time equivalents that someone is working. So for example, if I work full-time, then I'm 1 FTE. If I work only half-time, then I am 0.5 FTE. So the FTE for an individual should always be within 0 and 1. And then you should report the same way that you do for ER. So it's reporting the expenditure for that staff person. So what you'll enter is the amount of FTE that they worked, the number of months that they worked in the year, and then you'll enter the amount of expenditure on that person over the past year.
That's correct. I think the only other nuance is that the FTE for this inventory is monthly. So you want to think about how much of full-time does the worker work each month. So again, if the person works full-time, but works 6 months of the year, their FTE is 1 and their number of months worked is 6.
Great. And then I saw there were 2 other things. One was related to, so HRH being critical and PEPFAR plans of related to scaling up service coverage or service delivery and personnel related costs. So one thing I would like to emphasize is that the goal of this new reporting requirement is to help get a comprehensive understanding of the number and the types and the locations of staff that PEPFAR is supporting through its programs. So to help get a comprehensive understanding of what the overall staffing footprint is to inform more effective planning to support the activities that PEPFAR is supporting through its programs. So that's the overall goal of this reporting requirement, is to make sure we have a good understanding of the types of staff that are being supported, where those staff are located, and the details of what type of work those individuals are doing. There was one other question I had seen earlier too about what types of quality checks or how this information might be crosswalked against other sources of data by USAID. So one thing to think about is that if you report, $1 million in staffing expenditure into expenditure reporting, but you report an amount in this inventory that is very, very, very different than that amount that was in expenditure reporting, the AOR for your program might ask some questions about, oh, can you help us understand this? Because this seems like a big difference between what you report in the inventory and what you reported in expenditure reporting. We know that they will not be the exact same amounts because of a lot of the details Sarah has discussed today, but this will help us get a better understanding of where the expenditure on staffing is going and to what types of staff. The other things would be if, for example, if you work mostly on care and treatment, but the only people that were reported in this inventory for your program were listed as supporting testing, your AOR might have questions about how you're reporting staff or how you're allocating staff, because we want to understand the relationship between the types of staff that you're hiring, what those staff are doing, and the objectives that you're trying to achieve through your program. So things like the type of work that staff are doing, locations staff are doing. For example, if you're providing service delivery in a certain district, but there are no individuals reported in the inventory working in that district, that might also raise some questions about that. So using it as an opportunity to help provide more details about the types of staff that you're supporting, what type of work they are doing, where those people are located, and what the expenditures are on those people is the goal of this reporting requirement. So I know we have about 10 minutes left, and we have a few more next steps slides. So we'll go back to Sarah, and then we'll have a few more minutes for questions at the end. Thanks.
Excellent. Thanks so much, Geraldine. Yes, it's just 3 more slides of a wrap up here. So next steps. So here is Datum Zendesk. So again, it's https datum.zendesk.com. And so this is where you can find some key resources that are released by OGAC. So highlighted in here, it says 2 key places to find guidance and instructions. There's both Datum training and tutorials here on the left, as well as PEPFAR guidance here on the right. And this is where you will be able to find the information. And just to note, you don't need an account to find this information. This is just publicly available. The account is only for the template itself and that whole uploading process we just reviewed. Then down here on the right, this is the technical support. So again, if you submit for your Datum account and you don't hear anything, or you're having trouble with it, or you can't log in, this is where you're going to go. And so unfortunately, I can't help you with Datum and other folks. There's a whole Datum team, and this is how you contact them. So you would click submit a request, and that will submit a ticket to them, and then they can help you with that process. And here, this is the same thing as the slide before, but what I did is I just put in specific links, so that way it was a little bit easier to directly go to things. So when you get these slides, you'll be able to click here and just go directly to the intro, directly to the definitions, directly to the handbook, anything like that. And note that some of these have not been linked yet, and that's because they're not yet up on Datum Zendesk. So it says at the bottom here, so please check back regularly for more information. As more information comes out, we will also be pushing that out so everybody is aware, but always check Datum Zendesk. Again, here's what the front page will look like. If you go into PEPFAR guidance, there will be a section on HRH. Actually, maybe I can just, let's see, Datum. I'll just show you. So let's see if I can get this to work this time. So I think you can see datumzendesk.com. If you cannot, please let me know. So for example, if you want to look at PEPFAR guidance, you would come here and click here. You then have all of PEPFAR guidance, but again, specifically, we're interested in HRH. So you scroll to the bottom, and here is HRH. So you can see the handbook, definitions, and frequently asked questions, and introduction. Similarly, if we go back, and you were interested in Datum tutorials, you click here, you would scroll down to, again, HRH, and it will give you information for HRH specifically related to Datum. And then the last piece I talked about, again, going back to this home page, is here in the corner. So if you click submit a request, it gives you this drop down, and you have to follow, you can choose, I'm having trouble with data entry and validation, and it will ask you to fill out this information, and it will contact someone at Datum. So again, this is different from this, which is requesting the account. This is if you're having trouble with Datum or you want to find some information. Okay, let me go back to my slides here. I believe you can see the slides, but if not, please let me know. So in summary, these are your next steps. So prior to October 1st, we recommend submitting the form at register.datum.org in order to obtain an HRH Datum account and to access your final HRH template. Again, the final template will be available on October 1st. Review the template and guidance materials. This presentation and recording will be sent out via email. There's also the guidance materials I just showed you on Datum Zendesk. So you can also take a look at the handbook. If you have any questions about this training, we have a listserv here, Hrh Reporting.helpdesk@usa.gov. If you have mechanism-specific questions or OU-specific questions, please direct them to your ACOR, activity managers, and mission HRH POCs. At this time, please begin collecting data needed to complete the inventory. Again, we recommend that once you have your template, you begin uploading prior to November 5th into Datum to ensure that you have ample time to respond to any errors. So with that, I would just like to thank you all for your attention, acknowledging the Health Workforce Branch and the Expenditure Analysis Branch here, the HRH Mission POCs, and the PEPFAR ST3 for the HRH Inventory Development. And also a special thanks to the ASAP team. Thank you very much for helping us to put this together and helping us work through this webinar. So now I think we just have 5 minutes left. So happy to turn it over to Geraldine for any last burning questions. Please let me know.
Okay, great. Thank you, Sarah. And thank you everyone for your attention and putting in lots of questions and responding and engaging with the presentation as we have gone through it today. And we see the note about it would be helpful to send out the slides before the presentation. So thanks for that recommendation. We will we'll try to do that before the French and Portuguese webinars, as Susan mentioned. There were a few questions about A few more questions that we can take the last few minutes. So how do we make decisions about program areas of support if people are doing multiple areas and trying to choose among equal ones that they support? So if people split their time working on multiple things, how do we choose that? So I would say what we recommend you do is if people are splitting their time evenly working on different types of activities, you just choose one. If there's not a primary one that they spend more of their time working on than another, you just choose one of the two that they enter, because you can only enter one into the template. And we recognize there's a lot of that creates limitations then in what we can understand from the program area entered, because the example was if someone is splitting their time 50-50, half their time care and treatment, half their time testing, and you just have to enter one of them, then we know that we won't be able to tell that their time is split. So that's a limitation of this entry template, but we're aware of that. So just pick one if they're splitting their time equally. There was a question about, let me go up here. And Sarah, I'll ask you this one. For staff that have had a change of, or Sarah or Jason, but for staff that have had a change of employment title during the year or change in working mode, like they went from roving to no longer roving, or their title changed or something, should you capture the most recent thing that they were doing, or what do you recommend?
So I believe the current guidance is to choose the most recent option. If the person is truly employed by multiple IPs, then they will be on separate templates. But if the person still has, everything the same, they're on the same mechanism, then they would just report their most recent title.
Great. Okay, then there was a question about overall LOE, like how much level of effort do you expect that this will take for people to complete? So the amount of LOE is going to vary a lot depending on the number of staff that you support and the type of information that you already have available within your own systems about what your staff are doing. So for example, if you support really large numbers of staff and you maybe don't have all of this information together yet, it will take more LOE to fill this out than if you are just a small program that is only focusing on maybe above site activities and has 20 staff or 30 staff. So it will vary a lot depending on how many staff you have and the type of information you have available. But you can start, you can make sure that you have put together now, between now and the start of reporting, the information that you need to fill out the template, and that will help with the speed of your data entry so that you're not having to stop to go look for information. So we'll send out these slides in the recording, and there's the publicly available handbook on the Zendesk website. All of that has lots of information, definitions, examples, so you can make sure you have all the information that you need for the reporting in advance. So I think those are the main things. And I know we haven't been able to get to every question during our session today because we've had lots of great discussion, but we've been keeping note of all of your questions, and we will provide a written FAQ after the webinar with all of the details of what your questions were and responses and additional resources. Okay. All right. Any last questions? I think we will get ready to close out. I see one clarification. Are the prime organizations also going to account for the subs? It's a great question. So one template for the inventory should be submitted per mechanism to Datum. So if you are a prime partner that is holding the mechanism and you have several sub-recipient partners that are also working with you on the same mechanism, then we would expect that one overall template is submitted per mechanism, and that should include details of any sub-recipient staff that are working on that mechanism, as well as prime partner staff. So we might expect that you might have the sub-recipient partners enter information, and then you combine that information with the details of the prime partner supported staffing into one template, and then that is what is submitted for the mechanism. Okay. Well, I think we're at time now, so we're going to close the webinar for today. But thank you again, everyone, for all of your attention and participation today. And we'll be circulating these materials, and please don't hesitate to contact us if you have questions. Thank you.